So I'm going to start off by just giving you a little bit of an update, and then I am going to, we have a video to present, and Dr. Andrick will say a few words, but basically we're here so that you can ask us anything you want. I've had a little bit of practice with the Board of County Commissioners, so that's why I'm talking first. All right, so as of this morning, we have 4,459 cases, positive cases, to date here in Palm Beach County. That's 154 more cases today than we had the day before. Our total number of patients hospitalized so far since this began is 3,512. Those are 7 new hospitalizations as of yesterday. And we have 1,234 deaths, which is 18 new deaths since the last time we had these numbers. Now, specifically in the deaths, it's very important that at least all of you understand, and everybody that's watching this, that the deaths are put not on the day that we get that number, but on the day of the actual death. So when you see the numbers, the little columns changing, is because for at least 2 weeks, those numbers are being added where the person actually died. So if I die today, I go to the medical examiner's office or I go to my doctor and they decide to bury me. It takes a few days for that case to get reported. When that report comes in, the date that that death will be put on for me will be today, not by the time I get buried, okay? So that's been a problem that some people have because they say the state is changing the numbers. No, that is how vital statistics has always worked since the beginning of vital statistics. They get put on the date of death. So that has been confusing for some folks. The other thing that we have that we've been following very closely is our positivity rate. And there are 2 rates, and the reason we use a rate is so that the number of tests do not interfere with the number going up or down. It's a percentage. One rate is the total number of people since this began in March who have been tested positive divided by all the people that have been tested. That bucket is only 2 buckets, positives and negative people, cases. So when you hear case positivity, we're talking about cases, 2 buckets. You're either positive or you're negative. You do not get counted again if you're negative, and you would not be tested positive again if you're positive, right? So that goes from, the only way it would change would be a person who is negative and gets tested again. Now he goes into the positive bucket. All right? So that number is a big, big fraction with a very big denominator, right? So it's going to take a long time to get that fraction to start coming down. Unlike the daily positivity, or I try to add the word lab, the daily lab positivity number, which is the one that tells you the number of positive lab tests for that day divided by the total number of tests for that day. So there's nothing retroactive there. There's no past history from yesterday or the day before. It's that day. That's the number that I like, that we want to be below 5%, because that tells you the amount of virus that is circulating that day in the community, okay? And the reason we picked 5 was not because Dr. Alonzo likes the number 5. It's because it's been determined that that is a number that gives us effective contact tracing. When you're doing contact tracing with numbers that are 5 or 14 days old, you can't trace anything because it's already passed, and you can't prevent anybody from becoming positive. So now our tests are coming in about 2 days. We had a little dump the other day of some tests that were 54 days old. Hopefully they were negative tests, thank God. But that is going to skew some of those numbers, and so those numbers have to now be replaced by these. Our staff has to go through, it's about 200 pages of labs, and they have to go through line by line and pick up the duplicate tests by their names. And we did that. We found several duplicate tests, and so we corrected. So the number of for Palm Beach County, the number of the total people tested, the big fraction, is 12.77%. That number has been coming down steadily from 18, 15, and slowly started coming down. And it's been going down almost every day. A few days it stayed stagnant. The other number, the daily lab positivity, is at 4.04. It has been below 5 for the entire month of August. Okay, that's a very good thing. And at first, everybody was very skeptical that we would ever get below 5 because the state set the goal of 10. That's okay, but we want to be below that. And we knew we could achieve it because when we reopened the first time, we were at 3.9. So we knew that we could continue to go down. The virus will not go away. The virus will not disappear. H1N1 happened, a pandemic that happened in 2009. Guess what's in your vaccine with the flu vaccine this year? We put the vaccines in there because H1N1 circulates around the world every year. That's what viruses do. This is not something new. This is how viruses work. So they don't go away. They continue to circulate. This virus will be around for a very long time. Hopefully, we can get a vaccine that we will be able to decrease the level of the circulating virus, but with both sides being so polarized, I'm afraid that those who are against vaccines are not going to take it, and those that are for vaccines but want FDA approval are not going to take it because it hasn't been tested on people. So right now, it's only about a 21% that we expect people to take this. That's not a good percent to try to get rid of the virus. So as a result of that, we're going to be dealing with this for a long time. H1N1 didn't go down until the third year, and there was 2 waves. And I bet you that none of you, because you've probably looked it up now, but I bet you none of you even remember what happened in 2009. And you might not even remember H1N1. I named my cats, my 2 cats that I got that year, I named them H1 and N1. But my kids couldn't tell the difference. I said, what do you mean you can't tell the difference between H1 and N1? And they called them Black Kitty and Gray Kitty. Guess what stuck? Right. Gray Kitty and Black Kitty. And so to this day, they're still called Gray Kitty and Black Kitty. But I remember it because I remember doing all the statistics and all the stuff that we're doing now by hand and handing it to Dr. Malecki so that we could follow the virus and do the things that we did. H1N1 was not as complicated as this virus. So every virus is new, and we're still learning about this virus. Yes, we've been doing this since March, but it's a new virus. And so there's a lot to learn still about it. So yes, sometimes we change our guidance, or we change the way we look at it, or we change and say, yes, we need to wear masks, because we're learning about it. Okay? And 2 or 3 years from now, we will know a lot more about it. So our positivity rate is right where it needs to be in both our total and our daily rate. We're going to do everything we can to continue doing effective contact tracing. The county has hired community health care workers that are going out into the areas where we have higher numbers of positivity explaining to the people as they're having their tests done, as they're going out into the community, that we're going to be calling them. Our telephone numbers say DOH. We have signage up. We have instructions that we give to the people having their tests done, explaining to them that we're going to be calling, why we're calling, what kinds of questions they need to answer, so that we can catch those person that they're in contact with and quarantine them as quickly as possible. That exact mentality is what we're going to be doing in school. We're going to be giving to us the positive cases. We're going to have a COVID team here that will be, we will be able to contact and get information from. We're going to be calling the families of the children who test positive, and we will need to know where was that child sitting, who was the teacher, where did they go, where did they have lunch, did they ride the bus, what seat were they sitting in. So it's critical that those seating charts and those bus charts are accurate and that the kids sit where they need to sit. Why? Because we don't want to put out your entire class. We want to do this surgically and precisely, okay? We're going to ask, was the mask put on? Was the child wearing the mask the entire time? Was the teacher who maybe become positive, was she wearing the mask the entire time? Those questions are critical so that we can minimize the number of people that have to go out into quarantine. Now, ideally, we would be able to have rapid testing, which is now available, in the nurse's hands, so that nurse, when that child comes with the coughing or maybe a fever, we could test that child, call the parent, give permission to test that child, and say he's positive or he's negative. If he's negative, he's still going to have to go home because he still has a fever, but then we're going to have to do, we will instruct the parents and we will instruct the school and do everything that we need to do in terms of the way we do contact tracing. That's not going to be left up to the principal or left up to anybody else. We're not going to be closing down schools. We're not going to be closing down classes. Okay? We're going to try to do it precisely based on the contact that has existed. Now, why is that good? It's good because you're going to be sending a lot of kids home. Okay? Because there's no difference in the symptoms during flu season, especially that we're going into. The difference between a COVID and the flu or just the common cold. Sneezing, coughing, fever, achy, even diarrhea. Is it COVID or is it norovirus? Are we going to have to clean the school or are we going to send the kid home, right? So all these things, everything else that happens during flu season still has to be done through our epi department, and that's what we're here for. That's our expertise. You're going to be able to rely on us to do this. The healthcare district has the responsibility of, they hire these nurses that are at your school. We were the first county in Florida to have a nurse in every school, and we were very proud of that. That happened in 1997 when we made that arrangement between the health department that's responsible for the health actions that occur in any school, the healthcare district that hired these nurses and put all these nurses in place, and the school board that supports this and helps us. We had something unique. Other counties have tried to copy it. Everybody does it a little bit different. And those that don't have that now are calling me, how did you do that? How did you do that? I said, well, it's not just snap your fingers and do it. It took a lot of work, and we're very proud of what you have here in Palm Beach County. So we should be thankful for that. That's going to be a big help to the school and to the kids in terms of how we proceed. Are things going to change? Of course they are. Have you ever made a plan that you didn't have to change it 10 or 20 times? Any of you? Even in your home, right? Even when you go shopping. I go shopping for milk, I come home with $50 worth of groceries. Don't take me to Home Depot because then I really have to spend a lot of money. So this is the process that we're going to go. It's messy because it's real, because it's science, because, we're not doing anything to get rid of the virus. What we're doing is mitigating the probability of you catching the virus. That's why the masks, the distancing, washing your hands, not touching your face, the 3 C's, stay away from crowded spaces, large crowds, all those things that we have been saying is to mitigate, to reduce the probability of getting the virus. You can't stop it completely. But we can, obviously, through our numbers, you see that Palm Beach County has brought this virus down to a level which we can now be confident that we can send our kids to school, be confident that we can teach and provide these services that we're providing, and the choice for the parents who can afford to keep their kids home, and they can do that, that's great. I think that the kids going to school, I know Dr. Andrick, you're going to make your statement. Her daughter's definitely going to school. I don't know what she's been doing at home. She wants to get rid of her so bad, but she is going to school. So I am very optimistic that when we look back at this, we will see that, yes, this was hard, this was difficult, but in Palm Beach County, we always take care of our own and we always move forward in a good direction. So I'm very proud to be part of this group, and I'm here for any questions that you may have. I will let Dr. Andrick follow me.
Thank you. I think at this point we should play a video, and then I'll be present for. I think at this point we should play a video. They told me that I can say that we're going to play a video.
Hello, I'm Dr. Charmaine Scheibar, Medical Director for the School Health Program for the Healthcare District of Palm Beach County and Pediatrics Director for CL Bromback Primary Care Clinics. Our school nurses staff more than 200 registered nurses in nearly 170 public schools and serve more than 180,000 students from pre-kindergarten to 12th grade. The Healthcare District has been providing input on reopening schools. We have been working closely with the school board members, the superintendent, and key leaders to develop protocols around returning to classrooms. In preparing for the school year, we realized that this year will be unlike any other previous year due to the COVID-19 pandemic. As a result, we will need to adapt and change the way our school nurse program provides care for students in schools. For instance, the traditional use of the health room this school year will be modified in order to focus on students with suspected COVID-19 symptoms. Strict protocols for infection control and social distancing will be followed, and access to the school's health room will be restricted. All students with respiratory, gastrointestinal, or just general symptoms of feeling sick will be evaluated by the school nurse in the school clinic space. The school nurse will perform a screening and decide if student needs testing. The nurse will also perform testing once test kits are available. We don't have tests on hand at present time, but we are working on having a test at each school clinic in the near future. Sometimes this assessment is not easy, so the nurse will be able to consult the healthcare district's incident command team in real time, where physicians like myself will be available for guidance, much like telemedicine service. The school nurse will also help to schedule COVID testing at one of the testing sites available in the community. This can be time-consuming, but the school nurse will try to have it scheduled before students leave the clinic. In order to prioritize school nurse duties to respond to the COVID-19 crisis in our school settings, other duties related to non-acute or non-emergency medical conditions will need adjustment. If possible, teachers should call the school nurse or school district designee before the student leaves the classroom. Our goal is to decrease the movement of students throughout the school as much as possible when a health concern can be managed in the classroom. Depending on the type of symptoms and severity, a student may be referred to different locations to address his or her particular health concern. For example, those students who have other medical needs such as acute injuries, mild illnesses, medication administration management, or other procedures will be evaluated in the satellite area. This area might be just a hallway or office outside the health room and equipped with a cot and privacy screen for confidentiality. This area will be staffed by a school district designee if possible and will be in close proximity to the health room. It is anticipated that a school nurse will be occupied with COVID-19 assessments in the health room for the majority of his or her time. The school nurse will not be able to monitor and care for students in both locations, but will be available for consultation with school district designee when possible. Since medications will continue to be stored in the health room, it will require coordination between the school nurse, the school district designee for continuity of care for the students. Strong teamwork and communication are necessary for successful outcomes. Students with suspected COVID-19 symptoms will wait in the isolation room until parent pickup after they have been screened and assessed in the health room or satellite area. The isolation area will be monitored by school district designees in separate location from the health room. If the school clinic is large enough and if it is not occupied by students waiting for COVID screening, students can wait there for parent pickup. It is very hard to anticipate the volume of COVID screens that nurse will have to do on a daily basis, and if 6 feet cannot be secured in that area, then an overflow isolation room will have to be used. It is also recommended that all staff monitoring the isolation room should wear personal protective equipment or PPE. Students who are not already wearing a surgical mask will be provided one upon entrance to the room. The parent or guardian of the ill student will notify the school upon arrival and remain in their vehicle. A school district staff member will escort a student to the vehicle. As you can see, this year will require very close coordination and communication between school staff and our school nurses. These protocols have been designed to mitigate the risk of COVID-19 in the school health setting, protecting students, teachers, school staff, and nurses. Throughout the school year, we will continue with close collaboration among the Healthcare District, the Florida Department of Health, and the School District of Palm Beach County.
Hello, my name is Dr. Alina Alonso. I'm the director of the Department of Health in Palm Beach County. Brenda Galley, my director of school health, and I have been involved with your school for many, many years. It is our duty now to become very involved in the stopping the spread of COVID in the schools. In order to do that, we will be working closely with a school nurse who will be giving us information for any case or any child that comes to her who may be a suspect of having COVID. The child will be able to go get tested at many of our clinics or through their own private doctor and decide whether they're positive or negative. If they are positive, they then become a person that our epidemiology department will do contact tracing. Now, what does that mean? That means that we will be quickly and very methodically asking questions to determine where the child was, where was he sitting, was he wearing a mask, what classes did he go to, where did he eat at lunch, did he ride a bus? Many questions to determine the extent of the other contacts that he may have come in contact with. So this will not only make sure that we catch all the possible contacts, but it will also help us to eliminate the need for closing down entire classrooms, and certainly we do not want to close entire schools. In addition to clearing a person or one of the students, we will also be able to determine how many days that child has to stay home in quarantine, what other members of the family need to stay in quarantine, and how quickly they can return back to school. This will keep the number of kids out of school to a minimum. So this is a win-win for us in terms of stopping the spread, and a win-win for the school district to be able to keep your business running and people feeling safe and confident that we're doing things precisely and with the science and help that they need to get it done. Thank you very much, and we'll be seeing each other soon.
Hi, I'm Belma Andrick. I'm Chief Medical Officer of Healthcare District, Palm Beach County. As you could already hear from Dr. Chaybar and Dr. Alonzo, our agencies came together and worked with the school district leadership in order to help you better prepare for this very unusual school year. we try to define a little bit better what the school nurse role with the COVID is. You could also hear from Dr. Chaibar that those school nurses' primarily job this school year will be to identify who are the children with suspect COVID cases. Nurse will coordinate care of those children in the sense that she will perform screening, determine if that needs to be tested, and then coordinate testing. Nurse will also follow up on the results of this testing. Once the result is obtained, and if the result is positive, nurse will communicate to health department this result. From that point, health department will do contact investigation like we could hear from Dr. Alonzo. Those contact tracers will identify all close contacts to that child and also recommend isolation or further testing. Health department will also communicate to you what is the earliest date that all those children can return to school. That completes the cycle of following up on COVID case. Dr. Chaibar also talked to you about need to having satellite area that will be preferably in a close proximity to the health room because will require teamwork and strong cooperation between school designee and the nurse. We also talked about isolation area, and I know that many of you, as we speak, are identifying those areas in your school. Our organization will provide PPEs for your employees that will be working in satellite area and isolation room. I heard that many of you have fears how to staff isolation room. That fear is very normal, and many of us that are working in a COVID pandemic from early March have the same fears. But as a healthcare professional who use PPEs on a daily basis, I can tell you that I feel more safe when I'm wearing PPEs at work than I feel in my regular life. I'm also a parent who is sending a child next week to the school. Thank you for taking my teenager back. But I wouldn't send her if I don't feel that she's gonna be safe as long as she wears face masks, maintains social distance, do the good hand hygiene, and listens all instructions that you provide her. For that reason, I feel that whoever works in isolation room, as long as they wear personal protective equipment, they will be fine. So thank you. I hope that working together, we will do the best that we can under those circumstances. And I hope that our chain of communication will stay strong and we will deal with situation as soon as we encounter them. We are here to support you, and we are here to work as one team. Good evening, everyone. As you could hear, we really worked diligently in the last few weeks with school district leadership, health department leadership to come with a plan that everybody feels more comfortable because we have clear delineation of duties. Especially for healthcare professionals, we realize you are educators and not necessarily knowing all those healthcare rules and regs that we should implement while dealing with this unprecedented pandemic. And I think that this delineation of duties will help principals and school administrations really have that help that they need on a daily basis. And I think that with defining what nurse does, who is doing contact tracing, who is defining when the child goes back to school, will lift that heavy lift off the shoulders of the principals. We have incident command actually starting operating today. As Dr. Chaibar said in the video, we have physicians readily available for nurses and school employees for any question. We have calls today. We have kind of first run, and it was successful. We already conducted 6 screenings. There are 6 children sent to the health room today to be screened by the nurse. 1 child was sent home. He had a cough and runny nose. Mother picked him up, was cooperative, and said she's going to take the child to pediatrician for testing before he comes back to school. So it works in that sense. We hope that as time progresses, that incident command provide good guidelines for everybody. It's not easy always to determine is it COVID suspect or not, but I think as a team we will provide a good support for our boots on the ground. I just want to share with you that this was a very heavy lift, but very cooperative team that worked on this plan. I cannot say thanks enough to your leadership, especially Jay Bogus and Mr. Keith Oswald, who are here tonight. I think that they had a crash course in medicine last few weeks, and my team says we gave them honorary M out of MD. We're still working on that D, but it was very pleasure to work with. They were very receptive. Listened what we had to say, act really quickly, many late evening meetings and weekends, but I think that together we came with a solid plan. I'm here for your questions.
Thank you, Dr. Zandrick and Alonzo. Board members, you have questions for either of the doctors? Mrs. Whitfield?
Thank you so much. Thank you, both of you. Dr. Alonzo, I do know where I was in 2009. I was working for you. So I'm well aware of where that was. Two questions I wanted to ask. I wanted to know if you guys can talk a little bit about the impacts you've seen around the country when schools have opened and how much you expect the numbers to go up. And secondly, you mentioned the person that's going to be out in the hallway doing acute issues, like a broken leg or something like that. Are we giving training to that school district employee that's going to be doing that? Do you have any idea, or maybe that's a question for the superintendent?
So school designees are trained, and I understand, I'm going to let Dr. Alonso talk more about it, but as per Florida statute, school already have those designees. If the nurse is on a lunch break or is not that day in a school, they are trained for that. If not, they will be trained. But it's not really that acuity. Nurse still responds to all emergencies and work closely. It's just if we have a COVID kid in a room, that person will receive that non-acute medical condition and kind of keep them until the nurse is available, because we have to separate the space where we address COVID and the space where we address chronic medical condition. That's why we came up with that satellite area that is just outside the health room, so they can work as a team. But nurse should not have that child in the same room where she does assessment of the COVID.
Thank you.
Mrs. Andrews?
Wait, I had second part of that question. I think Dr. Alonzo is going to
answer her
answer.
second part, because I have to pay good attention to her because she was my former employee. So let me answer the school question maybe in a different way. What we have seen here, first locally, from the private schools that opened earlier and the universities that have opened, is that there are few cases in elementary, daycare, middle school. It's high school. It's that, you remember that age? Do any of you have the kids at that age now? When they start going out and they get fake IDs and they go to places that they're not supposed to go to. So it's that crowd that is becoming positive. Unfortunately, maybe they don't have so many symptoms, but they spread that in the home and to the other relatives. It coincides exactly with the age distribution that we have for COVID, and you can see that report in the floridahealth.gov under the county report. If you go to Palm Beach County on page 101 and 102, that report shows you that 55% of the new cases of COVID are in that age group between 15 and 44. A lot of those 44s are the ones that think they're still 20 partying like they're, well, anyway. So the point is that the biggest numbers are at the university level. So what we have seen across the country is a very similar example, that what is causing the spread is the large crowds, tailgating, football games, areas where lots of people are congregating, they're having fun the way they should have, and they're partying, they're drinking, they're speaking loudly, they're speaking over the noise of the music and so forth. And so the virus is spreading very quickly among that age group. Fortunately, in Palm Beach County, that age group has not had a huge hospitalization or deaths. There have been few, but it has kept our death rates significantly down. The majority of the people that die have coexisting conditions, and they're in the 65 and above age group. So with our schools, I think that knowing that gives us an advantage as we're opening a little later than some of these other schools to be able to anticipate those issues and address them not only in the school, but also in the community. So one of the things that we've been doing is we have the COVID education and compliance team that are going out to the businesses that we suspect are doing those types of activities. And in fact, we first go and we educate them, and then if we come and visit them again, if we see that they haven't complied, they get one more chance, and now we're fining them. And I spent the last 2 Wednesdays, today and last Wednesday, in the hearing boards for the code violations with a magistrate that is giving fines to these businesses that are refusing to comply by maintaining their doors open after midnight and having huge parties where people are drinking and having a good time, but spreading the virus. So we're doing, not only are we taking care of the school, but we have to take care of the community and all those events. I know my son's up at Tallahassee, and FSU is having a terrible time. And my son said, I get information wherever I can. I said, so Alex, what's going on at FSU? He goes, Mom, they're partying like there's no virus. Okay, so it spreads very quickly in the dorms. It spreads very quickly among those parties, at the bars. And if any of you have ever gone to Tallahassee, it's definitely a bar party town, right? I mean, you go from bar to bar down the street. And so it's no wonder that you have the perfect environment for this to spread. Now, maybe those kids won't die, but again, one of the issues that I've been very persistent in saying is we don't know what long-term effect these children will have. So this is not the kind of virus that you want to fool around and just get it and get it over with, okay? Certainly, I don't want my kids to get it. So that's a little bit of an answer in terms of universities having the higher numbers, the lower grades having less effect.
Mr. Barbieri, may I just finish following up on that a little bit more? I was curious because what I'm concerned about is that the community is going to see an uptick, and I want to know, what would be considered an abnormal, concerning level uptick for you when the schools open, and then what are you anticipating? What is something that you think we can handle as a community? Does that make sense? Maybe I asked the question
Yes.
badly.
We have been proposing that question to the commissions over and over again. We do not want to wait as long as we waited last time, but we know that we're going to have to wait to see a pattern occurring. We're not going to jump and close everything down the moment it goes to 5. So by keeping that level of that 5% and below, what we want to see is that it maintains. It may go up and down a little bit, but we don't want to see something that's continuously rising like we did when we opened up last time. And we just watched it go up and up and up and up, and we were just watching it. So it was very frustrating to sit there watching it. So what we've all agreed is that we got to jump on it right away, and hopefully we've gone down low enough for a long enough time, which is why we did not open phase 2, open everything. Because if we open everything, we don't know what's causing it. So the fact that we're able to open up schools now, we want to give it some time. I'm hoping for 4 weeks. I don't know what I'm going to get from the commission, but I'm hoping that we will have some time to see the effect of schools. If we do things right, we won't have an uptick because of the schools.